So,
Yeah. I
so
just did a conference, an international conference in Spain, and that one of my statistics that I remember I pulled out a study was 50% of the people with hip fractures die within 6 months, I believe
yeah,
it was.
it's dramatic. I
That's
mean, it's
dramatic.
dramatic. I mean, it's dramatic. And people don't think about that. They think, oh, I fractured my hip, it'll fix it. No. I mean, you do not do well with a hip fracture. And if you do not have hormones on board, nothing else you're going to do is going to maintain bone. I can tell you, I don't care how much stuff you take to protect your bone. If your
Mhm.
hormones are not in order, then that's not going to happen.
Yeah,
So,
just
so
before I just out of my head, in case anybody's following this and go, "Oh my god, I had a hip fracture at 35." It's over 65. It was people over
yeah,
65.
right,
Like,
right. It's as
that
you get
caveat.
older, right?
Yeah,
Yeah. So it's yeah. If you're 30 and you fall off your bike and you fracture
yeah,
your hip, you're likely to recover and do fine from that. It's yeah.
yeah.
These are more osteoporotic fractures. These are fractures that are induced, because your bone density is so low. And these these people fracture their hips and their spines. I see it all the time. Somebody literally bent over to brush their teeth and their spine fractures. So you get these compression fractures in the spine, and then yes, you see these old women who are just all hunched over, right, like that. That's from wedge compression fractures of all the thoracic vertebrae. The X-rays are astounding. I mean, astounding. And they have chronic back pain, and and don't rely on your orthopedic doctor to ever, if you go in with a wrist fracture or a hip fracture or a spine fracture, to ever check your bone density and recommend hormones. It just doesn't happen. They stick a big pin in your hip, but nobody ever addresses the root cause, and that's really criminal in my mind. I mean, that we're now just sending these people back out the door, and they fracture something else, or they die from that fracture. So cardiovascular disease, bone, and then in the brain. So we know that hormones are also very, very neuroprotective. Progesterone has a very, very neuroprotective effect on our brain. It helps us sleep. It's very restorative, but the brain directly has receptors. So, it has a direct effect on the brain as well. So we know that all of us fear losing our brains, and we don't have a lot of, we can tell you, yeah, there's so many things you can do, but one of the main things you need to do is keep hormones up to protect your brain too.
Mm.
So when you look at that list, cancer kind of falls down quite a bit. It's not even in the top five of those. Actually, it is. I think it's number five. But of the things and that we can prevent with simply using simple, well done hormone replacement. And as I
Yeah.
said, I think hormone replacement done well, you can actually reduce the risk of cancer, not increase the risk of cancer. So that should really go down the wayside. The other question I get so often from patients is when I put them on hormones, is, well, do I have to stay on these forever? And I'm like, well, I guess if we, find the fountain of youth and you can drink it and become 20 again, maybe not. But otherwise, unfortunately, you are aging. So it's not like all of a sudden your ovaries wake back up. As you said, like your patient, your 38-year-old, who they gave her a little cortisol and yeah, things perked back up. But in general, we're declining, right? And so to say, oh, okay, you're fine now. I've given you all the hormones you need and you're set for life is not going to happen. And when I stop those hormones, you're going to go back to your base level, which is going to be lower because you're older, and you're going to start at that stage. At least we boosted you up, so that's great, right? So you've made it back up to here. So now when you start to decline, it's going to take you a little longer, but you're still going to decline. And so I always tell women, I go, well, I guess when you're ready to die, you can stop them, But other than that, you should probably plan on these or something that are going to just become a mainstay of your existence.